Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Ghufran Babar, and you're watching my YouTube channel. Today's video will be on a very interesting topic, and that is monkeypox. A disclaimer that this video is just for information, and if anyone feels that they have monkeypox, should immediately seek medical care, and this video is not superior to the care provided by your regular doctor. So monkeypox is a viral disease through this pox virus that is transmitted to humans through animals, and once the humans get it, then they transfer it to the other humans. It started in Central and West Africa, and these days, since there's a lot of travel, so the disease has spread from out of Africa into the other countries, including the USA and European countries. And the virus basically, like I said earlier, is acquired either by through the animals when they bite, they scratch, typically rodents like rats, or by consumption of their meat locally or distantly. And then if once the humans acquire it, they can give it to other people. The transmission occurs by contact or with the suffering individual, or through the secretions, the body secretions, or the rash, lesions, discharge. It usually typically begins with an infectious symptom, which will be usually started with a prodrome, in which the people will have symptoms of fever, which can last for 1 to 4 days, lymph nodes, which are in the neck and rest of the body. They could be swollen, headaches, chills, sore throat, malaise, fatigue, and they may develop some lesions inside the mouth, or ananthem, or sores inside the mouth. The rash goes through stages. It could be a simple macule, which is not raised, or then it becomes raised into papule. Then it can form a fluid-filled vesicle, which can change into pustule, meaning pus-containing lesion, which can end after crusting or healing. And during the early stage of the disease, the virus is in the blood as well as in the skin lesions. And once the virus is in the blood, the body makes antibodies, and they could be detectable at that time. But those antibodies, they persist even after the disease dissolves, and helps in the detection that the patient had monkeypox virus infection in the past. Sometimes the scars can persist for a long time. So the course of disease, incubation period, when the virus gets entered either through direct contact with the animal or with some individual who has it, by direct contact, droplet infection, by mucous membrane contact. And during the incubation period, which could be 5 to 21 days, people may not have any symptom. So they will be symptom free. And following that, there is a febrile stage in which they will have fever for 1 to 4 days. And once the fever, with fever, they will have the lymphadenopathy, lymph glands being big, headaches, chills, tiredness, fatigue, malaise, sore throat sometimes. And then the rash stage is the third stage, which can last for 2 to 4 weeks. And the rash, like I mentioned earlier, could be simple flat lesion or raised lesion, papule, which could change into vesicle, which is fluid filled, or it could be pus containing pustule, and it could then followed by crusting or healing. And those rash lesions could be present anywhere on the body. Subsequently, in days or weeks, there is a period of recovery in a patient in which they recover from the rash, and 94% of the people will be 90 to up to 90% of the people will not have any serious problem. However, the death has been reported in up to 10% of people. So there are other two rashes. One is chicken pox and one is measles. They're similar because they may have fever associated with it, or just before the appearance of rash. They could have in monkeypox, the rash lesions are all in the same stage of development, versus in chicken pox they may be in different stages, that some may be flat, some may be raised, some may be in the healing phase, and same is in case of measles. And in monkeypox, the rash is more on the face and palms and soles of the body. So anyone who has rash on the face, on the palms and soles, should be suspicious of monkeypox. Chicken pox is more intense on the trunk. Measles, again, it is generalized, spreads from face downwards and reaches the hands. There is also a Coxsackie virus rash, hand, foot, and mouth disease, which could be similar, but in that you have hands, feet, mouth sores, and they may have rash on the bottom as well. Lymphadenopathy is present in monkeypox, versus other chickenpox may have it, and measles occasionally, but usually monkeypox definitely has the lymph nodes palpable, so they should be palpated. Death is up to 10% of cases, like I said earlier, in case of monkeypox, versus chickenpox and measles. Chickenpox is rare, and measles could happen, but less often. Usually it is a self-limiting condition, monkeypox, and resolves in 2 to 4 weeks. Very rarely there are serious conditions, and like I said, it is transmitted through contact with lesions, that is a rash, body fluids, respiratory droplets, some is coughing or sneezing, and being in contact with their contaminated material, and sexual transmission, especially in same-sex partners. Males who are having sex with males could be at risk for transmission through contact and through the sexual route. Treatment options, supportive treatment, there's no real treatment available. However, supportive treatment includes respiratory support. If they have any signs of respiratory illness, difficulty in breathing, they may need oxygen, and sometimes supported ventilator oxygen treatment and hospital admission. If there is secondary bacterial infection found, then they have to be admitted, and hemodynamic stabilization, giving IV fluids, IV antibiotics until they are better. If they have any GI symptoms, vomiting, diarrhea, they need to have hydration, as well as monitoring for signs of dehydration. Fever, supportive care, ibuprofen, Tylenol would be useful depending on the age of the individual. And skin lesions depends on supporting the skin lesions, making sure there's not too much of fluid loss. And sometimes antibiotics should be given to prevent secondary bacterial infection if there are too many open areas on the skin. And if there is lymph node enlargement, which are tiny glands in the neck and rest of the body, pain control is very important. And for eye, corneal regions, you have to give antibiotic drops, and monitoring for signs of worsening vision, and should be referred to an eye doctor if there are any problems. So the main reason for this video is that the WHO has declared it as a serious health threat at this time, not as compared to the COVID infection. However, awareness about this disease is very, very important. And if someone gets exposed to a monkeypox person, then they should isolate and make sure that they are not they don't expose other people if they develop the rash lesions, so that disease progression is not increased. People who are high risk, same sex people, like those who are involved, males in the same sex, they are at high risk. Lab personnel, healthcare providers, children, women, and a mom gets it, the fetus can get it too. So those are the high risk people. There is smallpox vaccine available, which it could be used. Cidofovir is an antiviral medicine. If someone is just exposed, immunoglobulins or IV antibodies can be given to prevent the disease and boost up the immunity. And if someone has gotten this monkeypox, then if you immunize, the duration and severity of the illness will be decreased. And there are vaccines available which are licensed in United States. Imvanex, Imva Immune, as well as a couple of names which have been accepted. And previously, in people who have been vaccinated for smallpox, is at least 85% effective in preventing monkeypox. So those people who are from countries where smallpox vaccine was given, there is a chance that they will be 85% chance that they will be protected against the monkeypox. So at this time, the experts, WHO, CDC believe that vaccinating everyone is not needed. However, high-risk people could consider vaccination, especially the same-sex people who males who are indulging in same-sex partners, healthcare professionals working in labs which deal with monkeypox virus, or who are doing testing for monkeypox, especially in the state of New York, where it is has been considered as a major health risk. So that can be done. So overall, supportive care, identification, and once someone gets it, isolation until recovery would be useful. I hope this video was useful in understanding some of the things about monkeypox, which is caused by the pox virus. Please like and share this video, and the best of luck. Thank you. Sallallahu alaihi wa alihi wa sahbihi wa sallimu taslima. Thank you.